Greetings from ECS Heart. My name is Dr. Abdelrazzak Al Kaddour. I'm consultant cardiologist at UE Medical Abu Dhabi. I really appreciate this opportunity to discuss very important topic, which is tobacco. What are the hazards of tobacco? What are the different kinds of tobacco? Is tobacco habit or true addiction? Is it illness? Do we have enough centers to treat tobacco addiction? Is it approved way of therapy? Well, let's start about the general concept about tobacco. Tobacco addiction is a true illness. Tobacco addiction should not be considered by physicians as bad habit or something we should just discuss to the patient at the end of their visit on their way out. You should quit tobacco and use our fingers. We should really take our time and discuss with the patient in very friendly way, understanding what is going on. Before that, as physicians, we should have little bit basic medical information about tobacco addiction. Nicotine is the powerful addictive material. Nicotine is more addictive than heroin, cocaine, alcohol, and any other substances well known on earth. Knowing this, that means we will be sympathetic and will be very friendly with our patient when they come with acute myocardial infarction or lung problem or any other things, We don't treat them as guilty because there are centers in the brain, call it alpha-4 beta-2 receptors, after inhaling, whether shisha or midwak or cigarettes or even e-cigarettes, within 10 to 30 seconds, those nicotine receptors are activated and go to the pleasure center of the brain and make the smoker feels good. So this is not something bad behavior, it's true addiction. Knowing this, then the approach to treatment would be different. And having said that, when we ask the patient in the history, do you smoke? We should not just stop smoke. Usually it's better way to use any kind of tobacco. Because many people say, no, I don't smoke, doctor. But then if you ask them more, you say, I do shisha, I do vaping, I do midwak. I mean, that's why when you say, do you use any kind of tobacco? When the answer is yes, then the other question, the quantity and the duration. How long you've been smoking? How many cigarettes a day, or how many electronic cigarettes, or how many shisha sessions? This is the second question. The third question, when you wake up in the morning, when do you take your first cigarette or first puff or first midwak? Because the quality of the history taken will categorize the patient into light smokers, medium, or heavy smokers. And this will give us baseline to really approach to their therapy. Now, well, many physicians say, doctor, well, we're not trained to treat tobacco addicts. Then what we need from you as general practitioner to ask few basic questions and spend 30 seconds, what we call 30-second counseling. Do you smoke? Yes. Now, what is your, talking to the patient, thinking about tobacco? And the third one, refer. So ask, advise, and refer. By refer them to tobacco center, which is specialized tobacco addiction, you increase the chance by having this smoker quit by 55% versus only 5% if you don't do so. So really 30 seconds. Now, if you're interested, if you have passionate, if you have special training, if you have time, then you ask those other questions in details. Why I'm saying that, because this is most of the time when we treat patient, we advise them and we say, okay, you can use nicotine replacement therapy and take gums or take patches and full stop. This is a recipe for failure. Because what do we do as tobacco consultant or tobacco in general? They are parallel way of therapy. We give them counseling, detailed counseling, and we give them medications, and it works. And as physician, you should know there are 6 steps in the brain between pre-contemplation, contemplation, and some other things to the point where say, doctor, I'm ready. So understanding those barriers and the tobacco addict make us sympathize and be more friendly with the patient. So if your patient is not ready, best thing to refer. If he's ready, if you're an expert, you start treatment or go ahead. Do not get intimidated by a patient who said, I'm not adequate. I'm fine with this. Doctor, I'm here for cough or other things. So again, just shake your hand friendly way with a smile and tell him, no problem, take your time. Please make sure you have educational material about tobacco addiction in your clinic. And you can always refer to centers. Now, there are three major things you should be aware of, what we call it modes of death. Unfortunately, we don't use this, we should not use it with the patient, but you should know it in the back of your mind. I mean, three ways that smokers eventually die. One of them, coronary artery disease. The incidence of coronary artery disease is 200% higher in smokers compared to non-smokers. The second one is lung cancer. The incidence of lung cancer in smokers 20 times higher. When we say 20 times higher, meaning 2,000%. The problem with the lung cancer is internal organ. By the time the smoker comes with hemoptysis and cough, it's too late. And the third one is, as you know, as physician, we call it chronic obstructive lung disease. Our lungs can't take that much. It takes up to 80% of destruction of the lungs before the smokers start short of breath and start complaining. So your goal is really to educate the patient. It's not too late, no matter how long he's been smoked, and if there is a will, there is a way, and this is illness, and there are steps you can take it with him. It takes 2 to 3 weeks only of treatment in the patient who is willing to quit smoking, even if he's been smoking for 40 years. Never too late. The last point I want really to get through, that always tell the patients not only quality of life. Yes, all of us have certain time we will die, but it's scientific evidence. People who quit smoking will have additional life. Even if he's a smoker at the age of 60, if he quit, he will have 3 years gaining of his life. If he quit at the age of 30, he will have 10 to 15 years more to live. So these things are so important to the patient. Talk positive. Tell him you live longer, better quality of life, you get much less chance of having illnesses, and always give them hope and don't give them negative aspect. And I really appreciate your viewing this, and I'm ready for any time for further discussion. Thank you so much. Have a good day.